This video will demonstrate the student nurse workflow of documenting the administration of medications for a patient using the Medication Administration Wizard, the MAW. In this example, we will document the administration of a scheduled medication, a PRN medication, and a dose of insulin. The insulin will require another witness. Ensure you always practice within your scope and negotiate with your supervising nurse regarding any patient cares, assessments, and medication administrations prior to administering and documenting in the IEMR. Your supervising nurse will need to validate the clinical data that you have entered into the patient's chart. For this video, we have already created a patient list in Care Compass, established a relationship with our patient, and discussed with our supervising nurse the medication that we will be administering and documenting. For this activity, we also have a second nurse as a witness for the insulin, and the BGL has previously been recorded. Our patient list is set up in Care Compass. The patient we're caring for this afternoon is Jocelyn. Let's enter into Jocelyn's chart. Click to select on her name. Jocelyn's chart opens. Navigate to the MAW from the menu. Ensure your filter is set to view all medications in the system. In this demonstration, we have kept the view option of Time View on display. Please note you also have Therapeutic Class View, Route View, Plan View, and Taper View. Return to Time View. Remember, you can always jump to the category of medications by clicking the various formats. For example, we can jump to the PRN section. We're now going to access the MAW. Click to select the MAW from the toolbar. The MAW window displays. The MAW could be utilised for administering multiple medications at the one time and allows the clinician to use a scanner both to identify the patient and the medication. This is not only for ease of documentation, but for patient safety. Scan the patient's wristband and confirm the correct patient details are displayed. Patient Jocelyn is on display. Note the grey clinical date range bar at the top. The MAW displays 75 minutes each side of now, as well as PRN and overdue tasks. We now will administer the insulin. Click to select the insulin. The result column now populates with the 8 units of insulin. Click to select. The Perform By field has pre-populated with our student nurse name. We will now acknowledge the BGL of 12.1 millimolars that was taken 15 minutes ago. We can see the insulin NovaRapid 8 units has pre-populated as the dose. Ensure the pen has been primed and dialed up to 8 units. And both your supervising nurse and nurse witness have visualised this as well. Administer the insulin to your patient. Ensure you perform all rites of administration prior to administering medications. Click OK. Now we will document the administration of the paracetamol and the coloxylin senna. Scan the paracetamol. As this is 2 tablets, we'll have to scan the box twice. Once, and it says we're now underdosing. Ensure you scan twice because we're taking out 2 tablets. The coloxylin senna. Take the bottle and scan the bottle twice. As you can see here, it says 2 tablets. We're underdosing if we scan once. Scan a second time. We have now marked all 3 medications as documented. Click Sign. Ensure you refresh the MAW. We can see the 8 units of insulin NovaRapid is pending validation, both by our supervising nurse and from the nurse witness. We can see the paracetamol is also pending validation, as well as the coloxylin senna PRN medication. Your supervising nurse will now validate the information. Click Change User. This video demonstrated the student nurse workflow of documenting the administration of medications for our patient using the Medication Administration Wizard, the MAW. This video covered the workflow of documenting the administration of scheduled medications as well as a medication, insulin, that required a nurse witness alongside your supervising nurse.